the confidential inquiry into premature deaths of people with learning disabilities. This film introduced some of the findings and recommendations of the confidential inquiry into the premature deaths of people with learning disabilities. The people in the film are all actors, but the offence described are real. For more information about the key messages, please look at the leaflet. Key findings. People die early.
Men with learning disabilities die on average 13 years sooner than other men.
Women with learning difficulties die on average 20 years sooner than other women.
3 times as many people with learning difficulties die before the age of 50 compared with other people.
Hi, my name's Bill, and these are my football mates. It's a lovely thing I love to do, and it's healthy. It's important to keep fit. My friend John, who was on the football team, he died recently. He died all of a sudden. John's story.
I really miss John.
Yeah, and I thought he was healthy because he ate all that fruit and veg from the shop he worked in. He hated taking tablets though. He used to tell me he found it hard to swallow them. I told him to go and get medicine instead, but he didn't like to make a fuss.
And he was always in and out of the hospitals, having his falls and fits. Should his doctor have asked if he could take tablets okay? I didn't really understand why he died though.
I was John's GP. I didn't see him very often. I do know he went to the A&E quite a lot, particularly when he had seizures. I only wish I'd invited him to the surgery more often, to talk through things, to manage his epilepsy better. Perhaps we could have involved the specialist nurse. I do know a few years ago I made a referral to the neurologist. I'm not sure now if I mentioned that John had learning disabilities in the referral letter. He was discharged after 1 visit. I assumed he was taking his medication as prescribed, but perhaps he wasn't.
I'm John's sister. He used to come round to us on a Sunday for his dinner. He really got on well with the boys and they really miss him. He used to manage well and live on his own. I helped him with his bills and things. Although I've been wondering recently if he needed a bit more support. And it turns out he hadn't been taking his epilepsy tablets properly. Maybe his support workers could have helped him with that. Maybe if they had, things might have been a bit different.
Key recommendation. Identify people with learning disabilities.
My medical records need to say that I have learning disabilities.
Key recommendation. Proactive planning.
People like me are more likely to die younger if no one spots the problems early. Annual health checks, health action plans, and planning ahead all need to be done.
Bill's story.
I'm Bill's mum, and I'm really worried about him at the moment. The death of John has hit him badly. He comes across as confident, but I know that he's ever so anxious and nervous.
Here we are, Bill, this is the treatment room.
He needs to go to the GP because he's diabetic, and we got introduced to the local learning disabilities nurse who was brilliant, and she arranged to go to the surgery with him late in the afternoon so there weren't too many people about, and she showed him around and introduced him to who was there, practice nurse, a GP, the receptionists. Meeting people at the surgery was really good. He used to be quite scared of going to the GPs. He now feels a lot more relaxed. They sorted longer appointments for him so it wasn't rushed, and he then had time to ask questions.
Key recommendations. Reasonable adjustment.
The law says that my doctor should make changes so that I'm having my needs met. just like everybody else.
An important message is that the changes that I need are clearly being written in my notes. Somebody should check that my needs are being met.
Karen's story. The confidential inquiry looked at the deaths of 247 people with learning disabilities, not just John. Karen lives in a residential home near here.
I was Karen's key worker. She lived with us for 8 years and I was her key worker for all that time. And so I got to know her really well. Karen had a number of different health problems and we had a lot of visits to the hospital to see different specialists. And it was very frustrating because they never seemed to talk to each other. It felt as if everybody knew a little bit of Karen and nobody actually had the whole picture.
Key recommendation: think of the whole person.
The doctor should think of me as a whole person. If I have a heart problem and epilepsy, the doctor treating my heart problem should think about my epilepsy.
Key recommendations: reasonable adjustment.
I would need somebody to help me with my different appointments and to keep an eye on my needs.
I'm the learning disability liaison nurse for the hospital. I knew Karen quite well, as over the last few years she'd come into the hospital quite frequently with chest infections. She was really ill on a number of occasions and I got the physiotherapists involved to try to improve her postural support because her body shape was affecting her breathing. Her body shape had changed so much that her lungs were all squashed up and it was difficult for her to eat and drink properly. It got to the point where it just wasn't safe for Karen to swallow, and it was suggested that she should be tube fed to help reduce the risk of her aspirating.
Key recommendation: the Mental Capacity Act.
The Mental Capacity Act is a law about decision making.
The Mental Capacity Act should be followed.
I'm an independent mental capacity advocate. Some people refer to me as an IMCA. I was asked to meet with Karen to see what she felt about having a peg inserted into her stomach. A peg is a tube where you can receive food and drink. The best interest process worked really well for Karen. I went to her home on several occasions. Someone Karen lived with already had a peg, and this allowed Karen to have a better understanding about what a peg meant. As Karen lacked capacity to make this decision, we held a best interest meeting. The consultant, myself, the hospital liaison nurse, speech and language therapist, dietitian, and the care home manager attended. The GP on this occasion could not attend, but myself and the consultant spoke with the GP to get their view. We agreed that the procedure should go ahead, and Karen coped really well with this, and we believe that her quality of life was significantly improved during that time. Sadly, Karen did pass away with pneumonia, but I feel we did do everything we could do at that time for her.
Key recommendation: high risk of respiratory disease.
Lots of people with learning disabilities die from chest infection.
If I have a chest infection, I'll need to go to the doctors quickly and get the right treatment. We also need good expert services to stop people like me from getting chest infections.
Emily's story.
I'm Emily's dad. She loved her football. I used to go and take her down to the local team. And despite her limited verbal communication, she would shout out loud when the team scored and was a nightmare when they lost.
I think that suits you.
When she started getting these stomach pains, I took her to the doctors, of course, and they said, oh, it's probably just constipation. And they gave her some medicine for it. But she wasn't right. I took her back. They gave her an x-ray and it looked fine. I asked for a referral. It took 4 months to get to see a specialist. And when we went for the scan, it was hopeless. She was terrified of all the machinery, you know, and the thing was that they wouldn't let me in to help calm her down. It felt like they just abandoned us.
I was Emily's consultant gynaecologist. By the time I saw her, she had lost a lot of weight, she was anemic, and she was unwell. She had been referred to me by a consultant gastroenterologist who had originally seen her because she presented with non-specific abdominal pain. He had tried to do a scan to identify her problem, but she couldn't tolerate having this done because she couldn't understand what was happening. I involved the learning disability liaison nurse, who showed her some easy read materials, showed her the scanner again and explained exactly what would happen, and she was then able to have it done. Because of that, we could identify her problem. She needed an operation, and so the nurse showed her the anaesthetic room, the recovery room, and she got used to people wearing masks. This was a real person. I think it's appalling it took so long for Emily to be diagnosed and treated correctly.
Key findings: importance of early diagnosis.
Sometimes doctors did not find out what was wrong with a person with learning difficulties quickly enough and did not always look into things properly.
Key recommendations: reasonable adjustment.
If I have problems using medical services, I should have help from a community learning disabilities team. Hi, I'm Katie. Emily was my best friend. We used to go to college together, then we shared a house. Her room was next door to mine. Emily went back home to live because she was ill, and her parents wanted to look after her. I missed her very much, but her dad and mum used to bring her over to see me. Sometimes we went for a coffee. No one told me she was ill. I knew she'd been in hospital because her staff here told me, but they didn't tell me she was going to die. I wished they had. I could have said goodbye to her and held her hand and told her that she was still my best friend, even though we didn't live together anymore. They think just because you've got a learning difficulty, you don't have good friends. But you do. And they also think you don't need to know about people dying. But you do. Now I'm scared of my friends dying and nobody telling me.
Key recommendation: the need for monetary deaths. We need a system for noting all deaths with people with learning disabilities. We need to look at some deaths with people with learning disabilities to find out why they're dying so early and to stop it from happening.